important to know how the examiner gives you a band score and what exactly they are looking for while assessing your letter in OET. I'm Kirti from Kirti Institute, and in this video, I'm going to give you an explanation on OET writing assessment criteria that will help you to assess your own letter once you finish your writing. So let me share my screen with you. I'm sorry, I'm taking a bit time. Okay, so OET writing assessment criteria. You are going to be assessed basically on 6 criteria, out of which number 1 is purpose. You will score between 0 to 3 for this criterion, whereas for other criteria, you will be scored from 0 to 7. So let's start with purpose. The criteria says that your purpose should be immediately apparent and should be sufficiently expanded into the course of the letter. This general purpose of writing a letter must be given either into the writing task or at the bottom of the case note. So this purpose should be should be written as a statement into introduction paragraph. And it should be sufficiently expanded. That means it should be explained in detail into the body paragraphs. The last paragraph should have detailed information about what exactly you want the reader to do. And to act for the patient, the reader should be also aware about the situation. So what is the matter? What are the patient's concerns and what have you done for the patient? That everything should be explained sufficiently into the body paragraphs. If you are doing so, you will fall into the category of band 3. But if your purpose is immediately apparent, but there is no sufficient explanation, then that means some lapses are there. Then you will score band 2, and band 2 is minimum requirement to score B. Band 1 is not immediately apparent and very limited expansion. Okay, so if you are targeting B or above, you should always think about band 3 for this criterion. Let's see the next criterion, that is content. So you should include all the relevant information. That means you are selecting the proper content. While selecting the appropriate information, you should ask yourself 2 questions. Number 1 is whether patient knows the reader or not. Okay, whether the reader and the patient knows each other or not. And the second question is the information which you are selecting is really required for the reader to provide continued care or not. Okay, if yes, you should include the information. Now, when the patient is already known, you do not need to write about patient's personal history or patient's background information, right? So the selection depends on that. You should also omit all the information which is out of the scope of the reader or the patient's care. So select the appropriate information very carefully. You should include all the key information and it should be presented accurately. In band 5, that is grade B, appropriate to the reader mostly addresses what is needed to continue care and generally accurately represented. That means if you are skipping 1 or 2 information which is not directly relevant to the reader, you can still score B. Band 3, that is C, says the information which you have selected is accurate to the reader. Key information required to continue care is missing and inaccuracies in content. Okay, so you will fall in grade C. Some of the points are matching with band 3 and some of the points matching with band 5, then you will score C+. So always keep band 7 in your mind and select your information. Next is conciseness and clarity. So what is that in conciseness and clarity? It is not only important to include the important information, but it is equally important to exclude irrelevant information. Now you think that what will happen if you are including irrelevant information? If you are doing so, you will distract the reader from the main idea. It will make the reader confused, or he may end up with some misunderstanding. Another thing is that the information which is important will not be highlighted. It will be hidden. So clarity will be lacking. So that should not happen. So you should also omit irrelevant information. When you are writing between 180 to 200 words, it is assumed that you are including all the relevant information and you have excluded irrelevant information. Okay, so the word count arranged to write a letter is 180 to 200. The selected information should be summarized effectively and should be presented clearly. Now let's see for band 5, mostly relevant information and mostly summarizes effectively and presents clearly. Okay, so this will be band B, okay, grade B, sorry. Band 3, let's see C for grade C, inclusion of some irrelevant information. You will directly fall into band 3 if you are including irrelevant information. It distracts from overall clarity of document. Okay, this will always distract the reader from the main idea. Partially successful to summarize. Okay, so this is for conciseness and clarity. The next criterion says genre and style. The language which you are using must be formal because you are writing as a medical professional. So your letter must be professional. The language and the tone which you are using must be professional, must be formal throughout your letter. Your language also should be polite and non-judgmental. Okay, non-judgmental, that means you cannot write anything by your own. Okay, for example, if the patient's case note says that patient has chest pain relating to the left arm, patient is perspirating or has distress, that means according to your knowledge you will feel that patient has myocardial infarction. But if it is not mentioned as a diagnosis or it is not mentioned anywhere into the case note, you cannot write by your own based on your knowledge. Okay, another area where it is seen that students are being judgmental is in patient's social background. Like patient is alcoholic, whereas it is written that patient consumes 600 ml of alcohol. Okay, so be specific in your writing that patient smokes 20 cigarettes a day, patient consumes this much amount of alcohol on weekend or during the weekdays. Okay, so you should be clear into your writing. Don't write anything by your judgment. Okay, let's see about the criteria. Band 7 says that writing is clinical and factual and appropriate to the genre and reader. Technical and polite language is used. So that means you cannot use the language that you are using with your friends on social media. Okay, like I'm going to hook you over there. I'm going to have this. So this kind of language is not accepted for OET writing, for any formal writing. Okay, abbreviations should be appropriate for document and recipient. Abbreviations you can use when the reader is from the is a medical professional. Okay, or according to my suggestion, you should try to avoid abbreviations as long as you are aware of its meaning, because some of the abbreviations are not universally accepted. For example, in India we use SOS, okay, to say when necessary. In Western countries it is used as PRN. So this is not universally accepted abbreviation, so you cannot use certain kind of abbreviation. So according to my suggestion, as long as you are aware of its meaning, try to write the meaning rather than using abbreviations. Try to avoid using abbreviations. Band 5 says occasional minor inappropriateness and minor inconsistencies are there. So you will fall in category of band 5. And band 3 says writing is inappropriate at times to the document and reader. At times, still you will fall into category of band 3. And over reliance on technical language and abbreviations, that you have used abbreviations and medical jargons too much that it is difficult for the reader to understand. Okay, so in that situation also you will fall in band 3. Let's see, the next criterion is organization and layout. Organization means how you are arranging your case notes. The order of your information should be appropriate for the reader. Now there are two ways to organize your information. The first way is you can write according to the degree of importance. Okay, that is called thematically. Okay, so whatever is priority, whatever the reader should know straight away should fall into your first body paragraph, followed by less important information. Another way of organizing your information is chronologically. You are writing as the patient has presented to you, especially when the several dates are given, especially for doctors when you are assessing the patient regularly. Okay, so you may write from the initial dates, okay, when the patient presented to you. For example, if patient presented 3 months ago, then 2 months back, and today, so you will write 3 months ago's history first, then 2 months ago's history, and then today's history. Okay, so this is chronological. Now the organization within the paragraph also should be appropriate. Okay, when you are starting with one theme, you should finish with that theme, and when you are changing the theme, you should change the paragraph. So the linking of the story between the paragraphs and linking of the information within the paragraph should be appropriate. Now let's see the band score description. Band 7 says organization and paragraphing are appropriate, logical, and clear. So whatever story you are making, it should be appropriate and logical. Key information is highlighted. Whatever is important should be explained into the detail. Subsections are well organized, so the important information should be explained in detail, and less important information also should be mentioned clearly and in a concise manner. Well laid out document, that means about the format of the letter, okay, and that will be explained into the next video. Band 5, occasional lapses of organization in subsection. So you can see that some lapses are accepted to score B. Band 3 says, for the organization, I always tell my students that you have to think once you select the information, if it is your problem to organize the information properly, you should think that while giving handover of the same patient to someone, what points comes first into your mind. Suppose the case note which you have, for that case note, for that patient, if you need to give handover to someone, or if you need to inform something to someone on call, what will you say first? Always the important information comes first in your mind. So you can think like that, and you can predict about what information should come first and followed by less important information. Okay, now moving towards band 3. Organization and paragraphing are not logical. That means I'm reading the paragraph, but I'm not sure what exactly you want to convey. Causes strain to the reader. That means as an examiner, I need to read your paragraph or sentences again and again to get the main idea. Key information not highlighted, and layout is appropriate with some lapses. Okay, so with this, all these things, you will fall into category of band 3. Last criterion, which is very important, and most of the students are concerned with this criterion, and this is English as a language. Your spelling, your grammar, your punctuations, your connectors, your sentence structures, everything is assessed as a language. So of course you must be aware where to use capital letter, where to use small letter, where to put full stop, where to put comma. So these all are important, but you should always keep in mind that there are also other criteria based on which you are going to be assessed. So being more concerned regarding punctuations, rather than that, it is better to focus on other criteria about what to select, what not to select, how to organize. Okay, but yes, you should always use correct grammar according to the timeline, according to which incidents has happened when. According to that, you should select the appropriate appropriate tenses, and you should write some complex sentences, okay, to help the examiner to assess your ability to use English. Okay, let's see the band description. Band 7 says spelling, grammar, punctuation, vocabulary, sentence structure are accurate and not interfere with meaning. This is also very important. When you are converting your case notes into the full sentences, you make sure that it does not change the meaning of the case note. Okay, so be very careful about this. Minor slips, but do not interfere with meaning. Okay, that means you are trying to write everything correctly, but still some slips are there, then it is okay to score band 5 or grade B. Band 3 says inaccuracies in language in complex structure causes minor strain for reader but do not interfere with meaning. Okay, so here you are using grammar correctly. This does not interfere with meaning, but still inaccuracies in language and in complex structure. So sometimes when I say to use complex structure, the students try to purposefully fit the complex sentence to show their ability to use it. But if it does not naturally fit into the story, you should not use it. Okay, so try to be natural, try to be simple in your writing. All right, so this is all about writing assessment criteria. At the end of the writing assessment criteria, you should you should have a checklist, okay, to assess your criteria. So how will you do that? You can write 5 to 6 points on one sheet, and then you can put a tick mark if you have done so. Like purpose, immediately apparent, sufficiently expanded. Well, put a tick mark. All the irrelevant information is omitted. Well and good. All the important information is included. Put a tick mark. Okay, you should assess yourself where you are lacking and how you can improve on that. Okay, make sure you have maintained a formal tone and a polite tone. You have been non-judgmental, and the information is in sequence. It makes a good and logical story, and you have used appropriate grammar and English as a language. I hope this video was very helpful to you. If it is so, please press the like button, share with your friends, and subscribe to my channel to motivate me to create more videos for you. Thank you so much for now.